Schizophrenia by Peter Mackay, Gemma Baker, and Sarah Harris. Schizophrenia is described as a common form of chronic psychosis where the affected person shows disordered and disorganized thoughts, unusual behaviors, abnormal speech, and altered emotions. Pathophysiology. Pathophysiology. There is research that suggests structural changes in the brain are linked to schizophrenia. For example, the enlargement of the cerebral ventricles and reduction in the size of the brain as a whole. Limbic, thalamic, and cortical regions may also show a decrease in size. D2 dopamine receptors, excessive activation within the pathway, are implicated in the pathophysiology. D4 dopamine receptors play a role, but to a lesser extent. Serotonin and GABA modulate dopaminergic neurotransmission in D2 and D4 brain region, meaning they also play a small role in the pathophysiology of schizophrenia. The mesocorticolimbic pathway, a brain pathway that controls emotion and behavior, shows heightened dopaminergic activity which can indicate schizophrenia in an individual. Starting at the mesencephalon, it connects to areas of the limbic system and the cerebral cortex. It has connections to various areas of the brain. Activity of this pathway is thought to underlie the disordered thought, emotions, and behavior. Contributing factors to schizophrenia are brain injury at birth, vitamin D deficiency, birth trauma, malnutrition, and viral infection while in utero. Genetic factors, environmental factors, and developmental factors can all play a role in the development of the disorder. Etiology and symptom manifestation in schizophrenia. Genetics, brain metabolism dysfunction, neural circuitry deficits, neuropathy, and biochemical alterations are all symptom manifestations of schizophrenia. In 1987, doctors published a medical scale titled the Positive and Negative Syndrome Scale, or PANSS. The presence of positive symptoms such as delusions, hallucinations, and thought disorders, overlooking the existence of alogia, apathy, avolition, or negative symptoms. The Positive and Negative Syndrome Scale is made up of three sections: Positive Subscale, Negative Subscale, and the General Psychopathology Subscale. As with all patients, the clinical reasoning cycle is used in the active treatment of patients with schizophrenia. The BPRS was developed in 1962 by Overall and Gorham and had been revised in recent years to accommodate new criteria. It is an assessment tool commonly used by clinicians to evaluate individuals who have received a diagnosis of schizophrenia or are suspected to have the disorder. It evaluates the individual's actions and behaviours over a period of 48 to 72 consecutive hours, assessing a range of 18 to 24 categories. Categories assessed by the BPRS include somatic concern, emotional withdrawal, disorientation, anxiety, depressive mood, hallucinations, suspiciousness, grandiosity, and unusual thought content. Another assessment tool used by clinicians is the mini mental state examination. This can ask questions that require answers, or it can ask of the person to do an activity, such Ultimately, diagnosis for schizophrenia comes out of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, known as the DSM-5. It outlines the criteria, which includes a set of 6 clinical presentations that may lead to a diagnosis of schizophrenia. The 6 criteria depicted within the DSM-5 are the active phase, symptoms, functioning symptoms, specific signs of disturbance, that a diagnosis of schizoaffective disorder or depressive bipolar disorder with psychotic episodes has been eliminated, that symptoms are not related to any form of substance abuse or pre-existing medical condition, and that an individual who during childhood has been diagnosed with autism spectrum disorder or communication disorders has met specific criteria. There is a criteria for diagnosis, and 2 or more of the following symptoms must be present with a significant portion of time during the first month unless they have been treated. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. Only one criterion A symptom is required if delusions are bizarre or hallucinations consist of a voice keeping a running commentary on the person's behavior, thoughts, or 2 or more voices conversing with each other. Medications. Medications used to treat schizophrenia can be broken down into 2 sections: typical antipsychotics, first generation, and typical antipsychotics, second generation. Examples of first generation are on the screen, such as haloperidol. Examples of second generation atypical antipsychotics are clozapine and quetiapine. Antipsychotic medications can have significant side effects, such as restlessness, metabolic syndrome, cardiovascular disease, osteoporosis, weight gain, tremors, sexual dysfunction, and physical impairment. Psychotherapeutic approach. Psychotherapy consists of 3 areas: individual, cognitive behavioral therapy, and group therapy. There are many misconceptions, and society's stigma can cause patients, their families, and carers to feel isolated and discriminated against.